Hello, my name is Sam. My health campaign was over the use of PrEP or Truvada. This is a medication that helps prevent HIV in sexually active people. I have focused primarily on the LGBT community. This is a very important issue because HIV is diagnosed in mostly gay and bisexual men, and that comes from the Human Rights Campaign website. In 2007, 38,739 people were diagnosed with HIV. This number includes people in the LGBT community. HIV stands for Human Immune Deficiency Virus. It is a virus that can lead to acquired immune. It is the virus that can lead to acquired immune deficiency syndrome, which is called AIDS, if not treated. So unlike some other viruses, the human body can't get rid of HIV completely, even with treatment. So once you get HIV, you have it for life. HIV attacks the body's immune system, specifically the T cells, which help the immune systems fight off infections. If untreated, HIV reduces the number of T cells in the body, making the person more likely to get other infections or infections-related cancers. So over time, HIV can destroy so many of these cells that the body can't fight off infection or disease. These infections or cancers take advantage of a very weak immune system and signal that the person has AIDS or the last stage of HIV infection. No effective cure currently exists, but with proper medical care, HIV can be controlled. The medicine used to treat HIV is called antiretroviral therapy, or ARTS. If taken the right way every day, this medicine can dramatically prolong the lives of many people infected with HIV. Let's see. They can keep the ARTS, or the medicine that prevents HIV or help fight HIV, can help keep people healthy and greatly lower the chance of infecting others. Before the introduction of PrEP or ARTS, let's see, people with HIV could progress to AIDS in just a few years. So before any of these medicines were introduced, a lot of people were getting AIDS, they were dying, stuff like that. So HIV can have many symptoms. The symptoms of HIV vary depending on the person and what stage of the disease they are in. The early stage and the clinical latency stage, or AIDS, and that's the last stage of the HIV. So there's 3 stages. About 40% to 90% of people have flu-like symptoms within 2 to 4 weeks after HIV infection, and that comes out of the CDC, Centers for Disease Control website. Let's see. I have notes on here. Sorry, give me 1 second. Flu-like symptoms can include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. These symptoms can last anywhere from a few days to several weeks. During this time, HIV infection may not show up on some types of HIV tests, but people who have it are highly infectious and can spread the infection to others. So it's important to remember that people can still transmit HIV to others during this phase, even if they have no symptoms, although people who are on medications may stay virally suppressed, having a low level of virus in the blood, are much less likely to transmit HIV than those who are not virally suppressed. If you have HIV and you are not on medications, eventually the virus will weaken your body's immune system and you will progress to AIDS, the last stage of HIV infection. But symptoms of AIDS can include rapid weight loss, recurring fever or night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands and the armpits, groin or neck areas, diarrhea that lasts for more than a week, sores of the mouth, anus or genitals, and pneumonia, or red or purple blotches on or around the skin or inside the mouth, nose, or eyelids are all symptoms of AIDS. And that's the last stage of HIV. So the target population for this campaign, for this health campaign I have chosen, is the LGBT community. In the United States, gay, bisexual, and other men who have sex with men are the population most affected by HIV. And according to the CDC, about 67% of people diagnosed with HIV in 2015 in the United States were gay or bisexual men. Among all gay and bisexual men, African Americans are the racial ethnic group most affected by HIV. CDC reports that in 2015, more African American gay and bisexual men were newly diagnosed with HIV than white or Hispanic or Latino men, gay and bisexual men. And that came from the HIV.gov website. Because of the high percentage of gay and bisexual men who are living with HIV, the risk of being exposed to HIV is increased for gay and bisexual men. Other factors may also put gay and bisexual men at risk for HIV infection. As mentioned in the beginning, my health campaign is about that medication called PrEP, and PrEP stands for pre-exposure prophylaxis, and it's the use of anti-HIV medication to keep HIV-negative people from becoming infected. And that comes from the website called whatisprep.org. PrEP is approved by the FDA and has been shown to be safe and effective at preventing HIV infection. Even though PrEP has been around in the U.S. since 2012, a lot of people still are looking to learn about it, and even fewer people feel like they know enough about it to be able to make an informed decision about whether or not to use it. People can find out about PrEP from their doctor's office, or many LGBT centers offer resources for people to take to their doctor's office. There are also booths at Pride events every year on the topic of PrEP. It's important to note that there are a few side effects that can occur while taking PrEP. The most common side effects people have reported for Truvada were stomach pain, headaches, and loss of appetite. Oftentimes, these startup symptoms are mild and go away after a month on treatment. Truvada is also associated with kidney problems in a small percentage of people and small decreases in bone strength in some people. Now, let's see. I'm going to scroll down on my notes. The two health messages I have created is a Facebook advertisement and a health poster. The first message, a Facebook advertisement, was created using a software called PosterMyWall.com. The dimensions of the size of the image was perfect for a more social media advertisement approach. The message consists of an older man holding up a blue pill that looks like Truvada, and the message speaks of the simple impact Truvada can make on a person who wants to prevent HIV. This simple advertisement can also mention how easy it is to take Truvada. This is prevalent with the words "one pill taken once daily, HIV prevention for a lifetime." Not only does it reinforce the idea that Truvada is simple once a day, not only does it reinforce the idea that Truvada is a simple once-a-day pill that's easy to take, it also suggests that people who are interested in being prescribed Truvada should talk to their doctors about the medicine. I picked the first message for Facebook because it's the most popular social media form out there. And this is it. You might not be able to see it very well because it's probably going to end up showing backwards on here. But here it is. It's a man holding a blue pill, one pill, taken once daily, HIV prevention for a lifetime. Just talk to your doctor about PrEP or Truvada. So that's the first one. So my next message is also a simple one, and is a poster you may find on LGBT Center. This poster was created on a website called Poster Maker. The poster consists of a simple blue background with a stock picture of a pill found on the top of the poster, and the words say "Keep Calm and PrEP Talk" are found on the poster. This poster is meant to spark a conversation. The poster doesn't give any details on the drug or what exactly it is used for, but when people look at this poster, they may ask, "What is PrEP?" This minimalistic approach serves to have the person ask questions and learn more about what Truvada is all about. I picked a poster because I tried using a background that would stand out and catch people's attention. Let's see. So here's the next one. This one should be blue. I didn't have any color It's blue. It should be blue. Keep calm and prep talk. Pretty simple. Meant to spark conversation. The first message will be distributed via Facebook and appear when scrolling through HIV articles on Facebook or through LGBT groups on Facebook. The second message will be hung up in various LGBT bars and clubs, as well as LGBT centers in the area. The importance of this issue to me as an LGBT student really helped me decide that I wanted to center my health campaign on HIV prevention through Truvada or PrEP. Thank you guys and have a great day.